This should not be going that way.
No.
Looks like a dent.
See how this kneecap is
That way?
this way?
Oh. Wow, I couldn't get in before. Come to him, guys. Yeah, it does feel better. I'm being honest. That's amazing.
Yeah?
You're the bomb, dude.
Tell me what you learned about your x-rays.
I know.
Because you've been to other chiropractors, right?
I have, and they have. It hasn't been this extensive. So what I see is the curve in that lower back, the adjustment that I need. There's a dent. Is that what would I call that? Right there.
Oh.
Yeah, like right
here?
there, right there. This should not be going that way.
No.
Looks like a dent. Like somebody hit me with a car. So.
Well, tell me
Be
about
educated.
your pain.
I've been experiencing major pains where I can barely like open my legs. Like that's probably as far as I can go because it starts to hurt really bad. Yeah, it looks so bad. It doesn't look normal. It's definitely abnormal.
Yeah.
When I compare it to that.
Yeah. Well, you're here because there's a problem, right? And
Yeah.
we got to find it. So.
Yeah. Fix me, please.
Yeah. Well, that's what I'm here for.
Like I can't turn that foot. You know, it's
You
that
can't turn
hip.
it inwards like this.
No,
Got it.
that's it right there.
Okay.
When if you do it, you can probably go, you know, the normal person can do that.
Yeah.
And even open their legs more. But that's it. I can go that way, but just, it's like going outward. So when I went to physical therapy, she's the one that brought that to my attention, like on the moves to do to try to loosen up my hip, and I couldn't do it. I couldn't do it. I know,
So
right?
but she gave you exercises for that? Did that help at all? Or?
No.
No.
It wasn't working. So then that's when I went to chiropractor, and then I just felt like he just wanted to crack me up, like, pop, pop, and I'm like, nothing's working. Like,
got
you know what I
it.
mean?
Just popping everything?
Just popping everything.
Do you feel that pain worse in the morning when you wake up, or?
Yeah.
Yeah.
I have to stretch my body out to
Yeah.
try to loosen me up. You know, I try not to rush out of bed. I try. Sometimes I have to. I was like, oh, I got to get up and go. But most of the time I try to, you know, do my due diligence and stretch my body and, you know, like try to relax my muscles because I feel like I'm tense. And I even went to somewhere called Stretch Lab. I'm not sure if you're familiar.
Yep.
You know Stretch Lab?
Yeah.
I went there. That didn't work. I was like, you know, I'm spending all this money and it's just nothing's working.
Yeah.
And every time I left, I was super duper sore, even worse than what I felt like when I got there.
Okay, let me see what we can do.
Yeah, I know. I'm be a good project for you.
And did you went to an orthopedic surgeon or?
I
don't remember
did.
that. Okay.
I went to orthopedic to look at my hips.
And they took an X-ray of your hip.
That's when they told me I have arthritis.
Yeah. Do you
Show
have
it this way.
arthritis?
Yeah, I do. You can see it too?
Yep. Yeah.
Yep.
So if you look over here, you have arthritis, and there's actually spur formation in there too.
Yeah.
Yeah.
You popping. Look at this guy.
Aw.
But he's far, so I was like, I need someone similar to him. And you.
That hurts, huh?
Yeah, it do. How you know? Ooh, yeah, it hurt.
because it's really swollen there.
Yeah, it hurt. That's where, now right there is,
Yeah.
that's where they shot me with the epidural 3 times.
Yeah.
That's where it really, really hurts.
Do you feel it really suck you down here?
Yeah.
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 Right here? Okay.
I mean, like right there.
There, the way where-
Yeah.
Okay.
Like who laughs in pain, right?
Not many people laugh with pain, but I'm glad you do. That hurts a little bit, right? Audra?
A smidget.
Is that
A
tender?
smidget, yeah.
Does it hurt over here too? Mm-hmm. Okay.
You know where it is, I see.
You have a reverse curve over here, so you know I'm gonna work right at the base of that lower part. This joint is stuck backwards, so we're gonna push it forwards. But the
That.
5, 4, 3, 2, 1, 12. So one of the things I'm going to work on is your rotated pelvis. Okay, so it's rotated basically down and like around. So we're gonna do the opposite. Okay, and straighten it out. That's part of the reason why you can't really like
Do that.
twist it. Like
Do that way.
work on that, and I'm also going to work over here because that has a big innervation, nerve innervation to your hip, like right in the front. Yeah. So later on, we're going to need to work over here where it's kind of tilting off. but I can't do that right away because that's right next to the joint. It's like literally inches away from the joint I'm going to work on. So we can't adjust in Gonstead. We can't adjust things that are right back to back because it just knocked the first one I did out. But I want to check out a couple other things too, if you don't mind. So I'm going to have you just walk around the room for me.
Okay.
Yeah, I want to kind of see how you walk. Yeah, just walk around the table for me.
Keep popping. Interesting.
So your right leg is pretty outwards. And can I have you stand right here for me one more time, Audra? I'm going to have you lift your gown up above your knees. Interesting. Okay. So you have a little bit of a rotation also in your knees as well. Does it hurt back here? Okay. And here it does.
Yeah.
So when you just kind of sit here normally, you see how this kneecap is like way
That
out
way?
this way? Yeah, versus
Oh,
this one.
wow. Yeah. I
So-
didn't even notice that.
Yeah, so
Oh, my goodness. I
Okay.
remember when I was 2, my mom, I think I was like 9 months when I was born. They said that I was born, they had to break my hip back
What?
into place.
Really?
Yeah. Yeah, I got a picture with a cast on when I was like 9 months. They had to break my leg back or something. My mom told me that before
Really?
she passed. Yeah, and I have a picture when I was literally 9 months, and I have a cast from there to like my thigh.
wow.
I wonder, does that have something to do with it, you think?
Good. Yeah. So, okay. Well, I'm gonna work on your knee too, but let's get started with the works before I do that.
Okay, here we go. So excited.
Shall we? So this is your C7, and we are going to give this a push like that. Okay.
Oh, wow. Oh, God.
Yeah.
Wow, I've never felt that before.
Yeah.
Wow. That felt amazing. I feel like I can go to sleep now.
Go to sleep. Okay.
Like, wow.
Good night.
Oh, my gosh.
That's good.
That felt awesome. Jesus, that was amazing, Doc. Okay, do something else.
Okay. Okay. Will do. Whatever you say.
Yeah.
Okay. Good.
Yes. Wow. I'm shocked. You got to excuse me. I'm just like so shocked. That was amazing. Wow. And when I do this, it doesn't, like, I can go all the way back now. It doesn't, it's not tense.
Yeah.
Wow.
Yeah, because
that
that's
was
the base
so
of your reverse
good.
curve.
Okay, continue on, Doctor.
Okay, let's go. Okay, let's get. Here's the top of your sacroiliac joint, and that hurts, right?
Hell yeah, that hurt.
Yeah.
Oh, it hurt so bad.
So that's the part we gotta close off.
Oh,
Okay.
okay.
So the sacroiliac joint is yay big from here to here, but the part we gotta close off is right there. Okay. So what I'm gonna do is I'm gonna roll you a tiny bit to me, but I'm not gonna let you fall off. Okay.
Okay.
Good.
Ooh, I felt it.
Good.
Oh, that felt so good. I feel like that was amazing. Wow. I'm shocked. I'm happy. Come on, continue on, Doc. Just
Okay.
break me up. Break me up.
Let me help you up. Let me help you up.
Okay. Oh, that was so good. Oh, and I feel like, oh my God. I feel like my posture is like more like natural. You get what I mean? Like before I was struggling and like doing this, like down, but now I feel like I can do this more naturally. Oh,
Oh
my
yeah,
God.
that's what you said, huh? Yeah.
Oh, And it's only session 1, Cameron. Dang, I feel good already. This is awesome.
Do a little bit on your knee.
Okay.
I'm not gonna go too hard on your knee.
Okay.
Oh, sorry.
No, it's okay. Just do what you gotta do.
So right there
Yeah,
is
that's
right
where it
here.
hurt. Yeah.
So this is a joint line. So that's this is your meniscus right here.
Mm-hmm.
So what we're gonna do is I'm gonna gently kind of push the knee in like that, because it's tender, right? So if I go too hard, it's gonna hurt. So I'm gonna try to just push some of it back in, just gently first. Just do a few reps like this. Should start feeling better even just doing that. Okay.
I can feel it in my hip.
Yeah, okay. I'm actually gonna work on that in a second too. So just a little push into here with my thumb, okay? Good.
Yeah, that felt good too.
Good.
Yeah, that was good.
Awesome. Your face goes in there and your knees go forward back
Okay.
onto that, okay?
Okay. Oh yeah, that hurt
That's
right
right.
there. Mm-hmm.
Okay. So we're gonna go very specific here. So this is a very small bone. I'm gonna put my thumb right here.
Oh yeah.
And just relax down. Relax your shoulders down a little bit. Like that.
Feel like okay.
Yeah, that's good.
Oh yeah. Oh, I felt it.
It's neat for me. Okay. So what I'm gonna do is actually do a hip distraction maneuver over here. Okay. So you got to put your foot over my.
Ooh, that don't hurt. But it's just like.
Feels weird.
Yeah.
Okay.
Doesn't hurt.
So do you mind if I kind of get right here?
Yeah, okay. I need you to.
All this is basically opening up your hip a little bit, okay?
It is, yeah. That actually feels good.
Yep. So we're gonna do a few reps before I give an adjustment into it. So this one doesn't really, well, I'm not looking for a pop, but I want space to open up into there. Okay. So we're gonna just, ooh, good. That's good.
Yeah, actually, wow. Normally when I do that, do you know how bad that hurts?
No, I don't, because you're in.
It's like I'm straining. Wow, I couldn't even do that before.
Nice.
Yeah.
I didn't even know that.
Jesus, I'm excited to come next week. Wow, that was great. Like I don't feel like I'm as tense. You get what I'm saying? Like I feel more relaxed. Like I can literally do this faster now. I couldn't do that before. Because I'm so scared, like it's gonna hurt. You get what I mean? But now it's like, in doing this, I could not do this, Doc, because I can't even explain the feeling. It's like I can't even explain what I'm trying to say, but doing this is like amazing. Wow, just that little movement, you wouldn't believe it. Come to him, guys.
Good.
Wow. Wow. I cannot wait to come next week.
Can't wait. Yeah, it's good.
Like I really now, I promise you after this, I feel you, I may be fixed in 3 months.
Yo, yeah.
I feel it. Oh, wow. Even my back feels better after that cracking thing. And pressing in, it doesn't hurt as bad right there. And I'm pressing hard. Am I tripping? Or am I just like making stuff up right now?
I don't know. You tell
That's
me.
what I'm trying to figure out. Am I just in my mind or? Because I don't know if I can do that. Wow. Yeah. Look at that. Yeah, it does feel better. I'm being honest.
It's good.
Yeah, I know, right? And it's only the first session. Wow.
It's good.
That's amazing.
Yeah?
You're the bomb, dude. Hell yeah.
Yeah, I already gave you the work, so.
I feel it. I swear. I feel like a little jelly roll, like just jelly roll.
Jelly roll.
It's like I just can fall over and sleep good.
Yeah.
I could feel that too. Like, yep.
All better?
Yes,
Good.
I do feel better. I
Awesome.
feel much better, like compared to how I came in. I was super tense, I felt like. You know what I mean? Because you don't know what to expect when you come in here. It's like you don't know what to expect. Bending down like this, normally when I pick up with my left side, I have to like pivot because this hip hurts. You know what I mean?
Oh, really?
Heck yeah, I got to kind of pull the foot back and do like this. But now look at this. It's like, that's a change and it's not hurting. Thank you,
Okay.
and I will be here on the 29th.
Sounds good.
Bright and early with some coffee for you guys. Bye, guys.
All right,